Dear members of the committee, dear audience, my name is Rita Vajna. The title of my big PhD topic is Clinical Pathophysiology of Polycystic Ovarian Syndrome. I am a PhD student and a specialist in obstetrics and gynecology on the Baroy Street department at the Semmelweis University. My mission is finding the best therapy option for higher ovulation rate, endometrial thickness, and pregnancy rate in women with PCOS. My vision is, with the best therapy, more women with PCOS can have a child. There are more specific goals. The title of my first topic is Strong Early Impact of Letrozole on Ovulation Induction Outperforms Clomiphene C-treat in PCOS women. This is a systematic review and meta-analysis. First, I would like to speak a little bit about the background. The incidence rate of PCOS is between from 3 to 10%, and PCOS is the #1 cause of infertility. The most important problem with this disease, high testosterone level, that leads to irregular period, and finally it leads to infertility. We have two good PCOS options for follicular stimulation. The first one is Clomiphene C-treat. This is an estrogen antagonist, but this drug has many side effects. The most important is endometrium thinning. We have an alternative option. The name of this drug is Letrozole. This is an aromatase inhibitor, and Letrozole doesn't show anti-estrogen effect, and patients tolerated it better. Our clinical question is Letrozole superior to Clomiphene C-treat in treatment of infertility in PCOS patients? On the left side, you can see my PICO, and my hypothesis is Letrozole therapy is superior to Clomiphene C-treat therapy in improvement of ovulation rate, endometrial thickness, and pregnancy rate. I carried out the systematic search with the following search key, and finally I found 25 eligible full text. I would like to present you my results. The first one is endometrial thickness. We can see on this forest plot that Letrozole using patients have thicker endometrium than Clomiphene C-treat using patients. The mean difference is 1.7. This result is statistically significant and clinically relevant. The second result is ovulation rate. We can see on this slide the Letrozole using patients have bigger odds for ovulation than Clomiphene C-treat using patients. This result is statistically significant and clinically relevant too. My third result is pregnancy rate. We can see on this forest plot that the patients who use Letrozole for ovulation induction have bigger odds for pregnancy than Clomiphene C-treat using patients. This result is statistically significant and clinically relevant too. My fourth result is resistance index and pulsatility index of subendometrial arteries. We can see on these slides that Letrozole using patients have lower resistance index and lower pulsatility index in subendometrial arteries than Clomiphene C-treat using patients. And this is a very good thing because with lower resistance index and pulsatility index, the subendometrial circulation will be better and embryo implantation will be better too. The summary was we used only RCTs, but we have some limitations. We didn't have sufficient data on live birth rate, and different drug doses were used across studies. Our conclusion is thicker endometrium, higher ovulation and pregnancy rate, and better subendometrial circulation was in Letrozole group compared to Clomiphene C-treat group. The summary is we recommend further RCTs to confirm our findings and implication for research. More studies are necessary reporting subendometrial circulation data. This is my first manuscript status. My article is under review in this moment, and I'm waiting for the answer. The title of my second topic is Investigating the Efficacy of Natural Products on Metabolism and on Endocrine Status in PCOS Women. The background is very similar to my first project, and we can say when a patient has PCOS, and beside PCOS, obesity and insulin resistance, finally it leads to, beside infertility, diabetes mellitus. In this case, the first-line treatment is metformin. But this drug has many side effects. But we have natural products. Natural products can enhance the positive metabolic and endocrine effect of metformin. And finally, we hope less metformin might be sufficient. Our clinical question was, can natural products improve the metabolic and endocrine status of PCOS patients? On the left side, you can see my PICO. And the clinical implication is natural products as an effective therapy to improve the metabolic and endocrine status in PCOS patients. I carried out the systematic search with the following search key, and finally I found 34 eligible full text. This is my second project progress. And I would like to show some results from our all result. The first one is calorie needs and the BMI between patients treated with only omega-3 or only placebo for a maximum 6 months without changing their usual physical activity. We can see on the right side that omega-3 using patients have lower calorie needs and lower BMI after the omega-3 treatment compared with the placebo treatment. The second result is the glucose laboratory parameter, and we can see on the right side that omega-3 using patients have lower glucose level than only placebo using patients after 6 months without changing their usual physical activity. My third result is HOMA index laboratory parameter between patients treated with only omega-3 or only placebo for a maximum 6 months without changing their usual physical activity. And we can see on the right side that omega-3 using patients have significantly lower HOMA index after omega-3 treatment than placebo group. My fourth result is triglyceride and cholesterol laboratory parameter in between these two groups. And we can see on the right side the triglyceride level and cholesterol level will be lower in omega-3 treated group than in placebo group after 6 months. And the fifth result is HDL and LDL laboratory parameter in the same two groups. We can see on the right side the HDL will be higher and LDL will be lower in omega-3 treated group than in a placebo group. And the summary was I used only RCTs, and limitation was effects of few natural products have been studied poorly without combined use of contraceptives or with metformin without changing usual physical activity. Conclusion is, among natural products we investigated, only the short-term intake of omega-3 caused the relevant improvement in various metabolic and endocrine parameters among women with PCOS. And this is my summary, and I would like to submit my second article in July. And the additional activities, I will have a conference presentation from my first project at the ISHOG World Congress in September. I would like to close my presentation with the following sentence: what you can't explain simply, you don't quite understand. Thank you very much.
I would like to ask a question about the first project. You mentioned that one of limitation is the different drug doses. So could you tell me how many milligram clomiphene citrate recommend to use for ovulation induction? Mm-hmm. Are there any national recommendation or guideline to this?
Mm-hmm. Thank you for the question. In Hungarian protocol is once a day 50 milligram clomiphene citrate or twice a day 50 milligram clomiphene citrate for ovulation induction. And the national guideline is the similar.
Congratulations. Just a question. Actually, I think that letrozole is not available for for this objective in Hungary.
Yes.
Do we have alternative for the clomiphene citrate?
Peros options, no. This is only this is only clomiphene citrate. And when the clomiphene citrate is not enough, in this case, we can give for the patients fostimon. This is an injection, an FSH injection, and this injection can help the ovulation. For the ovulation, thank you very much.
I have a question for your second presentation. Do you have any data about the effect of cinnamon for in this question?
Thank you very much. We have very few data about cinnamon, of the short-term effect of cinnamon, but we know from the literature cinnamon is an insulin sensitor too. But the short-term therapy is not enough to change the metabolic parameters.
Okay, thank you.
Let me allow a few questions. Congratulations to your excellent work. Well, could you tell me some further advantage of letrozole treatment for ovulation induction compared to clomiphene citrate?
Letrozole, we can use letrozole in breast cancer therapy, and we can use letrozole. Letrozole can.
But in case of ovulation induction.
Ovulation induction, what is the better effect of letrozole? What is the best?
Some further advantage.
Further advantage.
What about the...
I think letrozole can make higher, a little bit higher blood pressure. Therefore, it is good for the uterus circulation too.
What about the multiple pregnancy rate?
Multiple pregnancy. Yes, the multiple pregnancy rate is lower with letrozole therapy compared to clomiphene citrate therapy.
Okay, but it was interesting for me that in case of letrozole therapy, the endometrial is more thick.
Yes.
While when we apply it in case of breast cancer, the endometrial hyperplasia is not a frequent consequence of the treatment compared to the selective estrogen receptor modulators, I mean tamoxifen, because the endometrial hyperplasia is quite frequent in case of raloxifene or tamoxifen treatment.
Yes.
So it was interesting because in this meta-analysis, you mentioned that it is associated with enlarged endometrial compared to clomiphene citrate.
Yes.
Well, and the further question is, you mentioned the natural products. More than 300 plants contain some phytoestrogens. What is your opinion with the phytoestrogen treatment?
About phytoestrogen treatment, we have very few articles and few RCTs in the literature. Therefore, I have only relevant results about omega-3, and the other phytoestrogens I will write only in the systematic review, because I didn't have enough RCTs about these plants.
But phytoestrogens are considered as so-called estrogen disruptors.
Yes.
And could lead to increased risk for fetal malformations and abortion, yes. Spontaneous abortion. So that's why, in case of pregnancy, it is. I'm not sure that it is recommended to use it or not. But in Hungarian circumstances, the most commonly phytoestrogen consumption is related to linseed and soybean. So vegetarians are at higher risk for spontaneous abortion and for fetal malformations
Yes.
due to the fetal estrogen consumption.
Yes.
Okay, thank you.
Thank you. Thank you very much.
Just one comment on the introduction. You said PCOS is the most common reason for infertility
Um,
in your introduction for the first, right?
I don't heard
PCOS is the most common reason for infertility.
most common cause of infertility.
Yeah. That was on your first slide.
Yes, yes. The high testosterone level occurs in the body on ovulation and irregular periods. And when a woman doesn't have ovulation, in this case, doesn't come the baby and pregnancy.
So the correct statement would be PCOS is the most common reason for infertility in women. Because
Yes.
50% of the infertility is caused by men.
Yes, yes,
Again, precision is important.
yes.
Don't forget, because the reviewer, everywhere we're going to go, the reviewer's goal is is like narrowing down to find errors. And he finds in the abstract, in the title, in the introduction, and the first 2-3 errors he finds, he said, imprecise work. And then he doesn't even read the rest. So you need to be, every sentence, every statement needs to be perfect and needs to be precise. I mean, with all the work. And you have to, this is very important, specifically the introduction. Because
Yes.
you immediately will
Okay.
think precision statements. I mean, it's not important now in the presentation, but I think it's important.
Thank you very much.
Thank you.
Okay.
Thank you. Congratulations. I have only one question. That does the endometrial sickness is matter before letrozole treatment therapy?
The letrozole, yes, I go back. Yes, after the letrozole treatment, the endometrial sickness was not similar thick in every articles, and the reason is that the measure was performed by doctors, not by machines. And when the measurement make doctors and not machines, the measurement mistake is higher than when it makes it machines. Thank you very much.
What do you think? Why we can see a difference if we inhibit the receptor and if we inhibit the synthesis of the ligand? This is what happens in the estrogen.
When I don't heard the question.
So in one case you used the inhibitor of the receptor, the estrogen receptor. The other was the inhibitor of the estrogen synthesis, the aromatase inhibitor. Why we can see the difference in the effects? I'm asking the mechanism.
Thank you for the question. Yes, this is a very interesting question. When we letrozole try to yes, I will give you an answer. Yes. Yes, letrozole stopped the ovarian estrogen production, and they help to yes, I will say. Yes, I know, but I'm a little bit nervous. I'm sorry. Yes. I'm sorry.
Okay,
I'm sorry. I'm a little bit nervous. I'm sorry.
Research. Okay, thank you very much.
Thank you.